jump in here and tell us what you already know about CVI. That's so much easier to do when you're in person, but if you'd like to tell us what you know about CVI to get started, that'd be great. I'll wait a sec. I don't have the chat box open, so I'm going to guess Jen's not saying anything. We'll go ahead and move on.
Oh, sorry, I was trying to work on, and I think we are good.
Okay.
CVI is the brain and not understanding what the eyes can see.
Love it.
And, all right.
Okay, so our hope for you today, our goal for you is that we will help you increase your knowledge and understanding of cortical visual impairment. How you can, we're going to give you some general intervention strategies and some general strategies for modifying the environment for your students with CVI if we ever get back to school. As someone mentioned earlier, cortical visual impairment is about the brain, right? And there are differences between cortical visual impairment and ocular visual impairment. So CVI is a visual impairment that occurs due to neurological damage. While ocular visual impairment, they're caused by abnormalities or dysfunctions of the structures of the eye. And Dr. Roman describes it as, she defines it as CVI differs from ocular forms of visual impairment in that the interference in visual function exists not in the structure of the eye or the optic nerve, but in the visual processing centers and visual pathways of the brain. And just like our previous participant commented, it's about what happens in the brain, about how our brain interprets the information that's being sent to them. We know that CVI can happen in isolation, or it can happen in conjunction with an ocular visual impairment. So you can have just an ocular visual impairment, you can have just a cortical visual impairment, or you can have a combination of the two. And we also know that when provided with the correct modifications and interventions, our students with CVI, their functional vision can improve.
Hey, Becky.
Uh-huh.
We have a question of what's the difference between cortical versus cerebral visual impairment?
I think that depends on whom you ask. Lots of times people will use those terms interchangeably. There are some camps that feel like cerebral is a different form of cortical visual impairment. So I'm not sure that I can really answer that for you right on the spot, but know that some people interchange them, and some people feel like there are two distinct, different forms of cerebral versus cortical. Jen, you have anything that you want to add in there with that?
I wrote a report on this for a class, but I couldn't tell you off the top of my brain other more than it's, I mean, they are both related to the brain, processing visual information. Yeah, I can't pull it off the top of my head, but I can find it.
Okay.
Christine Roman does believe that we have a question of what does Christine Roman think in regards to the difference between cerebral and cortical?
So I would never be one to speak for Dr. Christine Roman Lancy. And that's a great question. I believe that, from what I understand with Dr. Roman, is that she believes that that cortical visual impairment is different from cerebral visual impairment and that those terms are not interchangeable. But again, she would be the best person to ask that question about what she believes. But if I remember correctly, Dr. Roman believes that CVI, cortical visual impairment, is separate from cerebral visual impairment. They're both neurological visual impairments, but kind of fall under different parts of that umbrella.
So we have a comment that my understanding is cortical is damage occurs in the visual cortex versus cerebral damage occurs in other areas of the brain that also impact vision.
Okay. I don't know that I've heard it defined that way, but that doesn't mean that that is not correct. So I think that there's still a lot of confusion about the similarities and differences between cortical and cerebral visual impairments. For this purpose today, we're going to strictly talk about CVI as cortical visual impairment and the impact that it causes our students in the use of their functional vision, but that might be a great topic for another webinar. Thank you. All right, so let's jump into the characteristics of CVI. I'm sure that we all know that there are 10 characteristics that are associated with cortical visual impairment. And these visual behaviors, while we say they're unique to CVI, you're going to see these visual behaviors occurring amongst other types of disabilities. But when we pull them all together and look at them through the lens of cortical visual impairment, the way that they occur and the way that we address them are different from other types of impairments. So the first characteristic that we'll talk about is color. We're going to talk in depth about each of these characteristics. So quickly we'll go through them with color, movement, latency, visual fields, complexity, 4 types of complexity that we'll talk about. We're going to talk about light, distance viewing, visual novelty, visually guided reach, and atypical reflexes. We know that when we talk about CVI, there are 3 phases, and how the student scores on the CVI range determines where they are in that in which phase they fall. So our students in phase 1, our goal for them is to build consistent visual behavior. We want to help them understand that they can use their vision for purpose. We want to help them build this really solid foundation of visual behaviors, consistent visual behaviors. And then as we move into phase 2, we want to help our students learn to use this vision that they've built and use it in a function, use it in an activity, use it to complete some type of activity, really integrate their vision and an action. And that's our goal for phase 2. I want everybody to understand that there's this huge gap. There's a huge space between what our kids in the bottom of phase 2 can do and what our kids at the top of phase 2 can do. It's this Grand Canyon type of thing if we think about phase 2, with really huge differences in skills from the bottom of phase 2 to the top of phase 2. And then in phase 3, we really want to help our students continue to resolve their characteristics, to really keep improving their vision. And we want to help them to be able to self-advocate, and we want to help them understand that they can take the strategies that they've learned in one situation and apply that to another situation, to really begin to generalize the strategies and understand how they themselves can implement them to better use their vision. Another thing that Dr. Roman talks about a lot is that CVI never fully resolves. That when we see students in phase 3 really have typical visual responses, excuse me, we can't say that they're resolved unless they're using that vision the same way as their peers in really complex environments, such as a concert or the lunchroom cafeteria or the gym during a basketball game.
I have a question.
Sure.
Now, this is Carol. I'm a school nurse for a child with CVI.
Hi, Carol.
So, if the child, like if you're continuing to work with his vision and you don't see them progress to level 2, like no matter what age or anything, they are always considered phase 1?
Right. So our hope is that when we provide the correct interventions consistently, provide those strategies and interventions consistently throughout their day, that we're going to help them build those neurological pathways that will then increase their ability to use their functional vision. So the more pathways they create, the more they can use their functional vision, which in turn creates more visual pathways. But there are times when our students can't progress past a certain phase because the insult to their brain is so great that our pathways aren't able to always create, we aren't always able to create new pathways. But I
Okay.
caution people to think that they've maxed out their students' ability for functional vision without backing, if you've reached a plateau, back up your strategies, because perhaps something has happened to create additional neurological damage. Perhaps a seizure has now created additional insults that we now have to work around. Or perhaps that the environment has changed so greatly that what they could do previously they can't do now because they're not fully supported in all of their CVI characteristics. So it's typically students will make some type of positive progression on the CVI range when given the right strategy. So I
Okay.
hope that teachers and parents and nurses such as yourself will always provide additional accommodations just to make sure that we haven't maxed out those pathways, if that makes
Right.
sense. I hope I
Right.
answered your question.
Yeah, that does. So continue to work with my visual therapist and teacher to try to reach him in any way we can to give him what he needs.
Absolutely. Your teacher,
Okay.
the visually impaired, absolutely. And if you find that you're providing strategies for a student in phase 2, and you've kind of plateaued, back those strategies up to simulate more of a phase 1. Or if you're in a phase 1, providing phase 1 strategies, back them up a little bit so that your environment is strictly controlled and the objects are one color, and we're providing the light that they need to see if we can't re-engage them back into visual activities.
Okay, thank you.
You're welcome.
Becky, there's some additional questions.
Okay.
One of them is that's kind of associated with what we're talking about is, does regression take place? Can a child in phase 2 go back to phase 1?
Absolutely. So we know that if our students aren't progressing, they're regressing or maintaining, and we do see students lose use of their functional vision when we don't provide those correct strategies and interventions. Just like any other things, functional vision can atrophy. So we want to make sure that we're providing those those correct strategies and interventions so that we're helping our students use their vision, because if they're not using it, they're going to regress. Absolutely.
Okay, and one other one, Becky, is how often are students with CVI and hearing loss misdiagnosed, and do we know the reasons?
Oh boy, what great questions you guys are asking me today. So the first part of that, Jen, was how often are there dual sensory impairments?
How often does CVI and hearing loss get misdiagnosed? So I believe CVI, when there is hearing loss also involved, how often do students with CVI get misdiagnosed, and do we know the reasons?
So I think that teachers and ophthalmologists are really good at identifying our students on the lower part of the range. So a student who is in phase 1 or low phase 2, we're really good at identifying them and helping them get those diagnoses. It's when we start to see students merging into high phase 2 and into phase 3 that the line starts to blur, and we need a really skilled person to help sort those out. So if we have a student in high phase 2 or phase 3 and their vision is inconsistent, lots of times we see those students being diagnosed with ADHD or something similar, because those behaviors tend to mimic each other. But we know that when we start to pull away the causes of their lack of visual attention is when we can kind of help to sort out if it's ADD or if it's CVI. And I think anytime we have a student whose needs are so complex, when there's a hearing loss and when there's a vision loss and when there's a global delay, those things all get kind of smushed together. And so lots of times the CVI diagnosis is overlooked because it falls into other categories of cognition or hearing loss. And when we miss it, when we miss that CVI diagnosis, then we're missing the opportunity to really help them use their functional vision. And I don't know why, other than we need more people who are aware of CVI, specifically phase 2 and phase 3, in those really tricky areas. And we need to be able to really pull out the strands of visual impairment versus other types of disabilities so that we can address those.
All right.
Alrighty. Good?
Yep, I think we are good.
Okay, great. Keep the questions coming. I love it. So we score our students, their functional vision. When we assess their functional vision, they get scored on the CVI range. And the assessment is scored from 0 to 10, with 0 being little or no visual attention and 10 being typical visual responses. And so our students who score a 0 to 3 on the CVI range fall into phase 1. And then students who score a 4 to 7 on the CVI range, they're given a score, they're placed in phase 2. And then 8 to 10 is a score, the score of 8 to 10 places students in phase 3. And again, in phase 1, we want to build those consistent visual responses. In phase 2, we're really thinking about integrating the vision and the task, the vision and function. And in phase 3, we're helping those students self-advocate and helping them figure out how to take those strategies and use them in different situations. And there, of course, is the top of the CVI range, Dr. Roman's CVI range, what we use to score the students. All right, so let's put this all together and talk about each of the characteristics individually. So for color, in phase 1, our students typically and generally look at one single color. Lots of times our students will have an only color. Sometimes they have a preferred color, and sometimes they'll look at a lot of colors, but only when they're presented one color at a time. So they'll look at the slinky that's yellow, and they'll look at the slinky that's red, but they won't look at the slinky that's red and yellow. So one single color, either just one solo single color, or lots of single colors. And then as we move into phase 2, into low phase 2, we're going to see our students look at objects that are 1 or 2 colors. And remember, if I didn't already say this, huge, our students in phase 1 and low to mid phase 2, we're using 3-dimensional objects. We're not using pictures or anything 2-dimensional. We're only using objects. And so our students in phase 1, again, single colors. Moving into low phase 2, 2 or 3 colors perhaps. And as we're moving up the range, we can see that our students are beginning to look at colors, beginning to look at objects of multiple colors and of simple patterns or more complex patterns as they move into phase 3. And so we can see with Mr. Potato Head, I would call Mr. Potato Head here a mid phase 2 student might look at this, but we can make Mr. Potato Head a low phase 2 by just taking away some of his body parts. That will keep him keep him in the area that a student in phase 2 will look at. So if a student in phase 2 will look at something with 3 colors, we can keep his shoes and his eyes and his ears, and he's still going to be in that student's range, so to speak.
Becky?
Yes. Thank you.
We had a question about should the object be put in front of a black background? Should the object that the student is looking at be put in front of a black background to help them?
Yes, and we will get to that when we talk about array, but absolutely we want to think about when we're placing these objects, how we're placing them. And that's one of our characteristics that we're going to talk about, complexity of array. But our objects, especially in those lower phases, need to be placed against a single colored background. And then we can see our counting frame here. Whoops, our counting frame. Well, our counting frame is about 4 or 5 colors. It also has a pattern. And so we want to be mindful of that when we're giving something like this to our student. But we can also modify this counting frame by covering up the bottom half or the top half that now allows our student to maybe manipulate these things that we want them to look at for counting or for helping with visual attention. If they can't look at the whole thing, then we can modify that and cover up just half of it. And then this crazy stuffed animal thing that's high phase 3 kind of thing with its multiple colors and patterns on it.
There's a question. So it's a CVI range tool question. Does a child have to score on each of the 10 individual characteristics, or for example, only 5 of the individual characteristics to be considered cortically visually impaired?
So of course, as teachers, we never diagnose a student. We don't have the legit reason, the legitability, right? We don't have the ability to diagnose because we're not medical doctors. But what we can do is say that the student is giving us visual responses that are similar to a student with CVI, which hasn't answered your question yet. When we think about a student only falling into 5 characteristics, are you thinking that the other 5 have resolved, that they're no longer, they used to be an issue, but they're no longer an issue, or are we thinking that they've, like, so I think I just need more guidance on your question. If we have a student who is in high phase 2 into phase 3, even into phase 3, we're going to see that they've resolved or nearly resolved a lot of those characteristics. So light, in most circumstances, light for a phase 3 student might no longer be an issue, and novelty may no longer be an issue. Perhaps they used to be, but they're no longer because they've improved their functional vision. So in diagnosing and identifying CVI, we look at not only their response to the 10 characteristics, but we look at their medical background. Do they have a history that would cause us to think that they have CVI? And does their visual impairment explain or not explain how they use their vision? So if they have, if they're nearsighted, but the way they use their vision cannot be explained by their ocular visual diagnosis, then that's one check in the CVI checkbox. The way they respond to the 10 characteristics is another check, and then their medical background is another check. So those are the 3 things that we consider when we're thinking about identifying a student with CVI and then seeking that diagnosis.
So expanding on that, I believe, Anna, I don't really understand what you mean by if they are diagnosed with CVI or were not present, not a problem. Oh, I think that's okay. So if they're diagnosed, it's not a problem, but what if they were never an issue? I guess if there were characteristics that they tested that they don't find any impact on certain characteristics out of the 10.
Gotcha. So there are plenty of times that we receive referrals for students who are already in high phase 2 and phase 3. And so when we test for those characteristics, the time that we're testing, the situation in which we're testing, they might not, their vision may not be impacted by novelty, or their vision might not be impacted by light. And their visual reflexes might be completely resolved. But can they show me those same behaviors when they're in the cafeteria with 6 other classes? Do they have those same behaviors, visual behaviors, in the auditorium when there's some kind of a concert going on? So are they consistently showing us those behaviors? Are they really not an issue? Does light never impact them in any way with using their vision? It's an issue in the most extreme cases. And I think that's where we start to lose sight sometimes, is that we'll see a student sitting in class and paying attention to the teacher and gaining knowledge. But as soon as the class breaks out into small groups and 6 small groups are having independent conversations, then our student starts to fall apart with their vision because they can't handle all that complexity. So we have to make sure that when we're assessing for CVI, we see them in multiple environments, because the way they use their vision in one environment might be completely different than the way they use it in a complex environment. Good?
All right. Yes.
All right. Let's think about movement. Movement is one of our next characteristics that we're going to talk about. So in phase 1, this is my favorite, movement there. Objects, our students in phase 1 need movement to gain and maintain their visual attention or their visual regard. And visual regard and visual attention and visual interpretation are 3 separate things. So when we think about visual regard, we're thinking about our students using that peripheral vision. I know it's there, I know something's there. You can tell that they know something's there, but they never bring their eye around to that object. That's visual regard. I know it's there, but I'm not gonna look. When we think about visual attention, we think about our students taking their eyes and putting it directly onto the object. So I'm showing my students something, they're looking at it, their eyes are on that object, they are attending to that object. And then we think about interpretation. Not only am I putting my eyes on this object, I am now gaining meaning from this object, and I'm understanding either what the object is or does, or what I'm supposed to do with it, interpreting the information from that. So our students in phase 1 with movement, they need that movement to gain and maintain visual regard or visual attention. It's usually in phase 1, it's visual regard. As we move into phase 2, we can see that our students need movement to gain their visual attention, but not always maintain their visual attention unless it's at a distance beyond 10 feet or whatever it is specifically for them. And then for phase 3, our students don't typically need movement unless they're in the greatest environment of complexity. And then we might see that they need movement to gain their attention. So here is one of our students. His little face is covered up. I apologize for that because he is so cute. But our TVI here knows that this student needs movement to initiate and sustain visual attention. And his latency is really great here. And so what you can't see in this, I'm going to play the video for you. What you can't see in this video is that the student is facing away from the lights that are coming down. It's our TVI in the back, our wonderful TVI. He has our student placed on this tumble form back, and he is rocking that because our student can't move, and the lights are kind of don't have enough movement, so our student is being moved to initiate that movement for him. And then we're going to see, if our smiley face weren't there, you would see him turn his eyes to the lights that were hanging down. So in this instant, it's not the object that's moving, but the student. And in the wonderful TVI there, he knows that the student has to have movement to initiate and maintain vision. So much movement. All right, the next thing we're gonna talk about is latency. And latency is just that. Latency is the time it takes for students to put their, to visually attend or regard the object that we're showing them, the target that we're showing them, the time it takes from when we present that to the time they actually regard it or attend to it, the latency, that gap in between of when we present it and when they look. Our students in phase 1 have prolonged, long periods of visual latency. I've seen students who've needed a minute or more to really engage their vision to the object I'm showing them. Prolonged vision. One, have visual attention, like I mentioned before. Lots of time we'll see them have visual regard. Excuse me. As we move in, our students move into phase 2, latency is still present, it's still there, but we see them have less latency. So if it used to be a minute, now we're seeing them need only 30 seconds. And the more we present an object to them, within that one activity, we might see them reduce that latency to 15 seconds. So latency for our phase 2 students is variable depending on the task and the activity, how much they've used their vision, how familiar they are with the object, and how crazy that sensory environment is. Our students in phase 3 continue to have latency, but typically that latency is only seen in the most extreme circumstances. Again, in the cafeteria or a concert or at a basketball game. If they've been sick, we're going to see them have increased visual latency. If they're trying to use their vision to learn a new concept in a complex environment, we're going to see increased visual latency. So all of those things come into play for latency, especially as we see our students in phase 3 CVI. We're gonna see it be very variable there. So I'm going to play Jen's favorite video. This is our friend Carlos, and Carlos, we're going to see his latency. Jen does a great job. He has a vision and hearing loss, and so she is showing him her identifier, and she's going to wait. Her patience and for latency in Carlos is fantastic. I love that one. I'm going to show you another visual latency because the videos are way better than me talking. This is going to be my friend Ben, I believe. Oh, it always makes me smile. So Ben's doing a couple things here. He looks at that target. He wants that water bowl. He wants to play in that dog dish, and I love his mom for letting him do it. So he wants to play in that water, and he sees it, and he thinks about it, and then he puts his hand in it, and he splashes around. And as he's splashing, his eyes aren't looking. He's shifting his gaze away so that he's only having that time with the water. And then he sits back, and he still looks away some, and he thinks about it. And then he looks back at the water bowl, and then he goes back for the water bowl, and he plays again. And so that's latency right there. The time it takes from when he looks at it until the time that he can look, until the time he goes for it. All right, let's look at this one. That's not it. How do I get rid of that? What? Get rid of the ad. Sorry, people.
Just click the button, skip ads.
Trying. My mouse disappeared. Here we go. So I want you to think about the light and how long it takes her to find it, and how she looks away from it, thinks about it. Comes back to it. Now, of course, this person isn't thinking about latency. They're thinking about visual fields and other things, but we can see the example of latency. There it is. There's too many things happening on my screen. All right, so those are our examples of latency. Any questions about that one? Moving forward.
I think we're good.
All right, visual fields. So visual fields is the next characteristic that we're going to talk about. And so in phase one, our students typically have a favorite or an only field. Their only visual field is perhaps their left visual field. That is the only place that we can get them to visually regard or visually attend to any object presented. As we move into phase two, we're going to see our students still kind of have that preferred visual field, but now they're going to start looking at things in multiple visual fields. So maybe the right and left, and they're starting to look at things in their superior visual field. That's what's going to happen in phase two. And as they move up through phase two, those visual fields are going to keep increasing. And then in phase three, we're going to see our students be pretty consistent in their left, right, superior, and central visual fields, and oftentimes have some real, still have issues with their inferior visual field. That's the one we see really resolve the last, and sometimes never at all. And so here we have this little cutie, and we can see that her preferred visual field is left. Everything, even when she has her body facing a different direction, her eyes are to the left. And here we have Ben again in the first two. He's working in his inferior field and his left visual field. And this little crooked here looking at those bubbles that are up in his superior visual field. And then we're going to move on to the complexity of array. Of course, complexity of array is what somebody had mentioned earlier, what we're presenting our objects again. So what is the background of how we're presenting this? And complexity of array comes into account when our materials are three-dimensional, when we're showing this object, but also when things are two-dimensional, when we're giving our students who are in high phase 3 a worksheet, and the amount of things that are on that worksheet come into the area of complexity.
Hey, Becky.
Mm-hmm.
We had a question. Could you explain inferior visual field first?
Sure. So inferior visual field just means your lower fields. We have your superior visual field and your right visual field and your left visual field, and then inferior is what's happening lower. Your lower visual field is your inferior visual field.
Thank you.
Sure. All right, so complexity of array. I'm going to show you this. It's the Ben Myers day. I love this kid and his mom, and so I'm going to show you the first. I'm going to show you the same object with different types of array. So here's Ben at home. His little coins are presented on a simple background, the carpet, one single color. It's not black, it's not white, it's kind of tan. It works for him. It's one single color. And the mom's going to be kind to him and put that into a field where he can see it, and there it is, and reach for it. Now let's see Ben with that same toy, his favorite toy. In a different situation.
Becky, while you're looking for that, there was a question. So is the inferior visual field about nose level and down?
I think it's anything that is, yes, below eye level and straight down. As things move out beyond you, so I wouldn't necessarily say it's things on the ground, because something on the ground 10 feet away from you is different than something on the ground 1 inch away from you. So your inferior field is anything that's lower than you. If you put something on the tray on your student, if they're in a wheelchair and they have their tray on, and you put something at the top of the tray, that isn't necessarily their inferior or lower field. But if you take that same thing, you place it closer to the body, then we might consider that their inferior field. So anytime they have to look down to find something, we're going to consider that their inferior field. And if I still didn't answer your question, please ask again until I get it right.
So far, so good.
All right. So we're going to see Ben with the same toy in school. And I have it set up so that the array is a simple black background, and on the table is a simple black cloth. So he's no longer independent here, as independent as he was at home. It's the same exact toy, a different environment, in a different array.
Becky, you may want to explain what's happening with him, because we're seeing the movement in the left video of him with the black background, but there's not much happening in the right video.
So we're only in this first video right here.
Okay.
Where he has the simple black background.
Gotcha.
And the toy. He needed some assistance to get those discs, the coins that are on the table. He needed a few prompts, but he kind of, after he was aware that they were there, he looked, he saw them, and he picked them up and put them in. The array here is what we can't see in this is that this black invisible board goes the whole way around. So he has a little workspace where there's nothing there but this black background. And on the table is a black cloth. So it's all black except for the things that are here. Now let's look over here at this one where the array is now different. And on this is a table with a plethora of toys, all different kinds of toys. And if you can't see the discs, they're here on the bottom right, where my hand just went. And he cannot even find them independently because there's too much there. The array on which we've presented them now makes them disappear for him. And we're going to see him get really frustrated. Yes.
Question, sorry. So does the use of varied colors of discs create the complexity?
Yes, absolutely. And that would also be, you might consider that array because there are so many of them. If they're all together, it might be complexity of object because they may all look like one object if they're all smushed together. Really quickly, Ben was having a little bit of an issue. He was frustrated, so he was now stamping his foot and whining and leaning back because he cannot use his functional vision to complete the task that he did in a separate environment. So jumping back to, pause that one. For Ben, he is able to look at the variety of discs of coins that he has here, the 5 different colors, and still find them. But if he were lower phase 2, or if he were lower phase 2, he might only be able to have 1 or 2 discs there in his array before he'd find them, and still use his vision to find them and pick them up.
Becky, what range value, where is Ben on the CVI range here?
Here, he is in a mid phase 2. And so we were really, Ben has, as you'll see, Ben is used a lot in my videos. Again, his mom and he is such a great model for our presentation. But in this video, you're going to see him in different various phases of CVI range. And so here at this point, I'm guessing that he was in mid phase 2, where he is looking at objects of up to 5 colors, 6 colors maybe, and he can still use his vision when there's low level of background noise. So I don't know if you can hear it in the classroom here, but there are other students making noise and there are other things happening, and he was still able to use his vision, which tells us that he is about a mid-range 2, mid-phase 2.
Becky, is there a mid-range for each phase?
So I think that phase 2 has the greatest range. As I said earlier, phase 2 has the greatest variety of ability. Our low phase 2 really needs strictly controlled environments to help them use their functional vision. But when we think about a high phase 2, which is going to be almost a 7, we're seeing them being able to start looking at and interpreting 2-dimensional materials. So phase 2 offers us the greatest range of variety. Phase 1 is so strict in what our students can do, so strict in the amount of accommodations that we have to provide, that it's gonna, it can have a mid, right? It could be a 2. If they score a 2, they would be mid phase 1. But we don't see that range of ability as greatly as we do in phase 2. Phase 3 is the same. We really see a lot of resolution and really see our students struggle most in complex environments. But the differences in the abilities within each phase is greatest in phase 2.
Okay. Do all materials in phase 2 still need to be 3D?
All materials in phase 2, until you reach a 6, should be 3-dimensional. We don't really think about students interpreting 2-dimensional materials until they're at like a 6. We will find that our students lower in phase 2 will look at 2-dimensional materials presented on a backlit background, but they're not necessarily interpreting that information. And so that's where we have to really start thinking about, are they looking? Are they just looking? If I'm showing them a picture of Elmo on the iPad, are they bringing their eyes around to it? Are they looking at it? I bet they are. But are they interpreting? Are they gaining meaning? Do they understand what it is I'm showing them? And that's what we see happening in high phase 2 and into phase 3. So the answer is yes, it should be 3-dimensional if you want them to interpret that meaning. But really on the cusp when you get up to 6 and 7 and 6 in phase 2 is when you start to introduce that 2-dimensional materials represent a 3-dimensional object.
Okay.
Great. So here we have more complexity of array. So this is one organized teacher, and I bet this teacher knows where every single thing on that shelf is. But our student in phase 2 CVI, and maybe even into phase 3, is not going to be able to find that beach ball because the array is too complex. I don't know if all of y'all can find that beach ball, but it's over here in the corner.
Hey, Becky, one question. With use of ASL for students who are completely deaf and have CVI, ASL would be difficult at first because it's 3D?
So this is a great question. And Jen and I talk a lot about ASL and CVI. And it's difficult in the fact that ASL is distinct in the way, I don't know, Jenna, how about you answer this?
Okay, so Kathy, this is definitely something that has not formally been researched, and really we're looking to do that at some point, because you are absolutely correct. It is difficult for individuals with CVI to manage the complexity of hand shapes, the complexity that often ASL is presented near the face, and all of the non-manual signals that come from the face that also imply meaning, as well as the visual spatial characteristics of that create different meanings and different signs based on how your hand shape is presented, or the perception of where your hands are in space. So yes, it is very complex for individuals with CVI to fully interpret ASL in its natural fluid form. And so why we try to at least like slow it down and isolate signs when we are teaching a new learner.
Great.
And there was a question about what is ASL, and thank you, Tasha. Yes, it's American Sign Language, is what we're talking about.
Perfect. So I can see that I am super long-winded, and it is 3:57. I am happy to keep going, but I understand if people need to leave after the hour is up. Jen, I don't think we run out of time. We don't get booted off after an hour, do we?
We do not. We have an hour and a half on the Zoom time, but what I'm going to do is switch over. If you pause for a second, because we're going to lose the interpreter while I do this, but I'm going to post the, we have a survey for you all. If everybody could complete a survey for us before you leave. So I will post that in the chat box, the link to the Survey Monkey. All right, and so you're good to go.
Ready?
Mm-hmm.
All right. So here is another example of complexity of array. If we want our student to find the scissors, it might be difficult. Again, well-organized, super organized teacher knows where things are. A student with typical vision would not have an issue of scanning that shelf and finding the scissors based on the salient features of what we know scissors are. But our student with CVI is going to have difficulty finding the scissors on that shelf. But if we provide a modification to the shelf, now our student with CVI can go in and find the blocks or whatever it is that we have there for them to look at. So that would just be, of course, a piece of black sheet or something over the shelf, letting just the part that you want the student to move towards visible to them. All right, let's move on to complexity of object. So complexity of object really ties closely into color, right? Because the more colors we have on our object, the more complex it is. So our students in phase 1, their level of complexity is one single color. They can really attend to a single color. It could be their favorite color, it could be the preferred color, it could be any single color. But the complexity in phase 1 is a single color, non-complex object. As we move into phase 2, again, we're going to see our students visually regard objects that have simple patterns or up to 3 or 4 or 5 colors. And then in phase 3, we're going to see our students really look at objects of multiple colors. And then we're going to think about the complexity of the sensory environment. So our students in phase 1 will visually regard familiar objects only in strictly controlled environments. So we see our first student here, where's my cursor? He is looking at the light box. Yes, he's in phase 1 and there are two-dimensional colors on there. He's looking at the color. But he is looking at this only in an environment where the lights are off and there are no other people in the classroom. Same goes in our next picture with Jen and our little guy here. He will visually attend to objects in an environment where there are no other students and the lights are low. The first student needed 0 lights other than the task lighting we were using here. And in the second, the lights were dimmed, but they weren't off, and there were other lights on in the room. And so that's a little higher level of sensory environment for him, but not as much as what we have over here for my student who is doing some O&M here. Depending on the time of day, is going to determine the level of complexity in this environment for my student here. So we are working here on the complexity of this environment is really low.
It's in the chat.
Becky, can you unmute yourself, please?
Better?
Yep, perfect. Thank you. I had to mute some.
And then down here we see my little friend Ben. He's saying the sensory overload is too much, and he's making a little sad face there and covering his ears. Then we can think about the classroom and sensory environment in the classroom. And so if we think about this first picture, we see all of our students sitting at their desk writing, the teacher is talking, they're doing their work. There might be an occasional pencil drop or gum crack or book closure. But this environment is still pretty well controlled for noise and movement. They're all sitting and listening. But then we think about this environment here on the right, on the top right, where it's an elementary classroom where students are sitting in groups and working together in groups. So you might have 6 groups of kids all talking amongst their groups, movement, papers, water fountains, all the things that happen in an elementary classroom. And so our students with CVI, even in phase 3, are going to struggle in this environment. And then down here on the bottom in our little clip art cartoon, it demonstrates. We have somebody knocking on the door, somebody rattling the door. We have people walking down the sidewalk, and all of the things that increase complexity in our sensory environment. Sensory environment. Now this is a fantastic school, and the art teacher is fantastic, but the complexity of this environment is beyond, right? So if you can imagine one of our CVI students trying to complete an art project in the classroom with 10 other kids working on an art project and talking, and teachers giving direction, this is a very complex environment. We're going to move on to complexity of faces, our 4th level of complexity. Our first was array, our second was object, our third was environment, and now we have complexity of faces. And we can see a varying level of complexity among everybody's face is different. Unless you're an identical twin, you're not exactly the same as anybody else. And so faces are really hard for students with CVI, not only to regard or look, but also to interpret. And so our students in phase 1 typically use visual regard only to familiar people. And so they're not going to look at their mom, they're not going to look at their dad, but they're going to know they're there, and you're going to see a change in their behavior. They're going to see them smile when their mom or dad get close to them. But it's rare in a low phase 1 or mid phase 1 where they'll actually turn to their parent and look at them in their face. We see that begin to happen in phase 2. So our students in phase 2 are going to have visual regard to unfamiliar people, but have visual attention to familiar people. So they're going to look at their mom, they're going to look at their dad, they're going to look at their siblings, but they're going to visually regard somebody who's new. And then in phase 3, we're going to see our students visually attend to most faces, except again in the most extreme environments. And here we have our friend Ben. And again, Ben was a mid phase 2. And this is how he greets his parents. I haven't seen him for a few months, so I don't know if he still does it, but when he greets his parents, it's first a regard, and then it's a turn and look. All right, so let's talk about lights. Previously, when Dr. Roman first brought her book out, we had light gazing and, oh, what was the rest of that? Non-purposeful gaze. What Dr. Roman is saying now is there is no non-purposeful gaze, and all gaze has meaning. And we want to look at light in a new way. We want to look at light, number one, how we use it for our students to gain and maintain their vision, but also how do we modify and control the light, excuse me, so that it doesn't distract them. So for our students in phase 1, they are consistently attentive to artificial and natural sources of light. So we see them staring at the ceiling light, staring at especially if it's a ceiling light with a fan. We see them staring out the windows. That light is so distracting to them that nothing else can gain their visual attention. And that's when we want to start facing them away from windows. We want to start controlling the overhead lighting and the natural lighting coming in from windows and doors. Our students in phase 1 need us to do that for them, need us to control the light in the environment. When we see our students moving into phase 2, light is still going to be a distractor. They're still going to be drawn away from their activity by the light, but they're also going to be easily redirected back to the activity, even in the presence of that light. And then, and in phase 2, and in phase 1, and phase 2, and in phase 3, we're going to use that light as a tool. So in phase 3, typically students have natural reactions to light. They're going to, blink when it's too bright, or open their eyes wide, or when there's not enough light. Except in the most extreme circumstances, of course. You're probably tired of hearing me say that. But in each phase, we want to use this light to gain and maintain or gain our students' visual attention. And so phase 1, all the overhead lights are out, and the only light is the one that's on the object, like in our Slinky here. I credit the Slinky to Jen. I have multiple Slinkies now with this light attached to it. And where is my cursor? So the light is just a silver Slinky, the old school metal one, with a push light hot glue to the bottom of it. So I turn this light on, I move the Slinky, it's now an object that's lighted. That's for my phase 1 or low phase 2 kids. When we think about phase 2 students, we think about using a task light. Like, we don't have to control the overhead light so much, but now we're using this light to draw their attention, a light box, a task light, something that helps them shift their vision to whatever it is we want them to see. And then we can kind of take that light away, because after they see it, they don't need their vision anymore. They don't need that light to maintain vision on the object or task. So here on the bottom, where we see this cute little guy in the field of sunflowers, it would be nice to think that he was looking at the sunflower, but probably if this is a kid with CVI, he's really looking at the sunlight that's coming in between those sunflowers. And then my friend Ben down here on the bottom right, he loves to climb up on anything close to the windows and look out the window to see the light. Here we can see students using light as a tool, right? Light is never the activity. Light is the tool that we use to promote the activity. So for this little girl, she's using the APH cups and shapes for sorting activities, and we're using the light as a tool to draw her attention to the activity. And then over here with Clifford and Emily Elizabeth, we're using this backlighting to support visual attention to the 2-dimensional materials that are on there. And if it's a phase 3 student, we're hoping that this student is now going to tell us about Clifford and about what Emily Elizabeth is doing and being able to interpret that information. And then we're going to move on to distance viewing. So our students in phase 1 are really only able to view objects in arm's reach. We see this little guy here in the beginning. He is playing with the things that are on his tray. That's where our phase 1 students operate, within their arm's reach. And then as we see our students progressing through the CVI range, we're going to see them starting to look at things at 2 feet and 3 feet and 5 feet. As they're progressing through the range, we're going to see them looking at things at 15 feet. And in phase 3, we're going to see them viewing things at 20 feet and beyond. And of course, all of these things that we're talking about with the CVI characteristics can be altered or impacted if the student has an ocular visual impairment. And so we have to be really mindful when we're thinking about distance viewing. If our student has an ocular visual impairment that keeps them from seeing beyond 15 feet, regardless of the amount of CVI interventions that we provide, their ocular ability only allows them to see to 15 feet. So we have to be very careful that we're always considering if there's an ocular impairment and weighing that against the CVI characteristics.
Becky, there's a question. Sorry, I'm running captioning at the same time. How do you know how close to put things for a phase 1 student?
So for a phase 1 student, you want it to be right within arm's reach. And you want to, there are multiple things to consider. For our phase 1 student, we have to consider each of the 10 characteristics. So we want to make sure that we're providing them with that single colored object presented on the black background in a well-controlled environment with a task light on it, with all of the things that we consider, considering each of the 10 characteristics, and then putting it within arm's reach and really giving them that time for latency to look. If we don't honor that latency, we're never going to see them look. So the short answer to that question is within arm's reach. We want it to be, 14 inches, maybe 12 inches, or closer to them. But always remembering that in addition to presenting it to them in the correct distance, making sure we're still accommodating for each of those CVI characteristics.
I think the issue was that sometimes my teacher puts things right in front of him and it seems too close.
Absolutely. So distance viewing doesn't mean in your face. Nobody's going to see anything this close, right? So present it in a reasonable distance, give lots of latency, and then from there determine if you need to move it closer or a little bit farther away. But right up in somebody's face is never really what we need.
Yeah, that was what was happening. So thank you for clarifying that.
Sure. All right, reflexive responses. So this is really about threat. Can our students, can they respond to a visual threat? Do they realize that something is about ready to cause them harm? And so our students in phase 1 don't blink whenever we touch them on their face. They don't blink whenever we bring an object towards their face. They have no regard to a visual threat. We don't see that. Like our baby in the first picture, his mom is touching his nose, and this little baby is not blinking in response to that threat. We can see our comedian friend over here. Can't think of her name right now. While she is not doing this model for a CVI presentation that represents it, right? She's touching her nose, she's touching the bridge of her nose, and she's closing her eyes. She's reacting to that visual threat being brought to her face. And then our tennis player down here, this is another example of not blinking to visual threat. This is the threat coming at our face, right? And he's like, ah, it's coming, but he doesn't blink or respond to that. That's a no response to visual threat. As opposed to our little guy over here who's about ready to be hit with a baseball. He saw that threat coming. He reacted to that threat. He closed his eyes and he turned his body. He's still going to get hit probably. But this baseball is an example of responding to a visual threat coming towards your face. And the tennis player is an example of a visual threat where you don't respond to something coming towards your face. All right, visually guided reach. So visually guided reach simply means I'm going to look at something and I'm going to reach out for it and I'm going to pick it up and I'm going to hold it in my hand and I'm going to manipulate this thing. Visually guided reach, I'm using my vision to find something and then grasp it. And so our students in phase 1, taking away when our students don't have the motor ability to reach, like that doesn't count. But when our students have the ability to motorically reach or swat or bat at something, that's when we consider this. So our students in phase 1, remember, just have this visual regard. So we're not going to see them look, but we might see them use that vision, use that visual regard, know something is there, and then swat for it. So they've never looked at it, they've never provided visual attention to that thing, but they have reacted to it because they've swatted at it, or they moved their hand on it, or they put their hand on it. So they are using their vision to guide their reach, but they're two separate actions. In phase 2, we're going to see our students look at it and look at it and then maybe look away from it and then put their hand on it and pick it up and look back at it. Or they might look at it, and right before they get it, they turn their head away. So they're no longer looking at it as they're touching it. These are all things for visually guided reach. In phase 3, our students are typically integrating that vision and touch, vision and reach, vision and grasp. It's all done as one single motion, except, say it with me in your head, in the most extreme circumstances, in the cafeteria, in the concert, on the playground, we may see them shift their eyes away just when they reach for that ball or just when they reach for the bat, in the most extreme circumstances. I'm going to stop talking. I'm going to play you a video. And of course, it's Ben. And Kelly's objective is to get him to drink water. But we can see that he needs assistance bringing his hand, but he's using his vision to reach out for her mouth. He is unable to visually attend to that cup and hold it at the same time. He uses vision to reach out and touch Kelly's face. All right, now where's my, I'm sorry. All right. Let's look at another video.
Becky, 1 second. I'm assuming, Anna Rose, that you know that we have completely lost your video. I'm hoping you're not there auditorily anymore either. Maybe she'll
I'm sorry,
come back.
you've lost my video?
No, I have your video. We've lost our interpreter, so I am trying to caption as long as hopefully our individual that needs it is able to access it.
Sorry, I have too many things on my screen and I can't pause this. All right, so did you need me to do something else, Jen?
Nope, not a thing. I was just seeing if Anna was still there auditorily.
Okay.
I don't think she is.
All right, so here's Ben. Completely different now, right? He is looking at the goldfish. He will. He's reaching for that goldfish. He's giving his eyes on the goldfish and he's putting it in his mouth. We can see that when Ben's home, his visual behaviors are much different than when he's in therapy or when he's at school because the environment is different. Last one for this.
Becky, you have about 10 minutes left before we will lose
Okay.
the video.
Not looking and reaching, but now looking and touching. Looking away and reaching. And looking back. Oh. All right. Novelty. Quickly, we'll do novelty. So novelty, our students in phase 1 will typically only visually regard known objects, right? And so that's the trick, right? How do we get something to be a known object? Make sure it's their preferred color, presented in all the ways that we talked about, addressing each characteristic. And then from there, when we want to introduce a new object, we're going to tie the pieces that are familiar to the student and help bridge that gap into something new. So here we see that with shape and with color, right? If their preferred color is this amazing volleyball, can we use that? Can we tie that to a globe when we want them to look at the globe? Same progression for random objects. Their favorite thing is a slinky. They love the red slinky. They will look at the red slinky. They will play with the red slinky. When we want them to eat, can we use the red spoon to get them to visually regard the spoon, visually attend to the spoon, pick it up and eat with it, or find their scarf among other scarves using that color cue of red. The same thing with the grocery store. Tying in what a student knows about one grocery store, and then using that information that's familiar to them, talking about the salient features of that supermarket and tying that into a new grocery store. So taking a novel environment as a new grocery store, tying it to something that they're familiar with, so that we can help them add that to their visual schema.
Well, hold on, Becky. What is the benefit of Ben looking away when touching?
Complexity. And so he cannot manage touching and looking and listening and experiencing all of those senses at one time. He can, at this point, he can look at the guitar, he can reach for that guitar, but he can't manage to maintain vision because the complexity, because of the sensory inputs of the touch and the hearing, adding the vision and exceeds his ability to tie them all together. So he looks away, he is able to process that information, and then he's able to come back and then kind of tie them all together. But for the initial instance, he can't put them all together. He can maybe do the two. He can do the hearing and the touching, or he can do the hearing and the looking, but he can't put all three of those things together. So he has to kind of shift away from one initially until he can process all that information, and then he can bring the third sense back in. All right, I am not going to do, there's a really great video that shows all the characteristics, but we don't have time for that. Let's do a quick game of name that phase. So if we see a little puppy, a single colored puppy on that nice simple background, anybody want to take a guess about what phase this might be good for?
1.
Phase 1. What about now?
Hold on. Captioning at the same time. If people want to talk as well, that might be helpful. 3. So we're getting 3s for this.
Yeah, unmute yourself and shout it out. What about now?
3.
I would say 3, or maybe a high phase 2. And if you covered half of that up, it could definitely be for mid phase 2.
3.
Yeah, high phase 2, phase 3.
1. 3.
Yep, high phase 2, maybe mid phase 2. And again, you can cover up half of it so that only part of it's showing to modify that Toy
1.
1. And the wonderful thing about this is that it's going to be shiny and we can make it move.
Mm-hmm. 3.
Phase 3. Kudos to whoever said that because it's a simple thing, but it's two-dimensional. It's a phase 3.
Thank you. 3.
Phase 3. What's the complexity?
Maybe a 2.
Yeah, so what's the complexity? You're right, it'd be about a mid-phase 2, but what complexity are we talking about here?
Well, you've got the environment around him, but he's got solid colors. The man has solid colors.
Yeah.
On the face, and the faces are complex.
Yeah,
And
exactly.
he's in arm reach.
Complexity of the face.
3.
And what's the complexity?
That's just a lot of stuff.
Yeah, and so it would be complexity of array, most likely. And you would have a student looking for something in this classroom, and that array would be too much. I actually brought, my student was on a scavenger hunt, and I had her familiar items, and I put her familiar item on the fence because the fence is three-dimensional. She could not find that thing. She loves that toy. She will find that thing amongst many, many other objects, but she cannot find it in this array. Complexity?
3.
Yeah, 2. My phase 2, phase 3. Oh, and there we are. So I didn't update this. Dr. Roman, of course, has a new book. So I would encourage you to look at those. Many thanks to all of our wonderful models. Questions that we didn't answer yet?
What's the book name of the book again?
Can you go back? Yeah.
Cortical Visual Impairment Advanced, this is Advanced Principles. Cortical Visual Impairment Assessments, Edition 2.
Okay.
I have it somewhere. Any other questions? Please remember to fill out the evaluation. That helps us keep our grant coming. It helps us improve things for the next time.
Becky, if we want to go back, I did find from Perkins, their definition of cortical versus cerebral visual impairment was that cortical was damage to the visual pathways and the occipital lobe, and
Okay.
cerebral was damage to areas of the brain beyond the occipital cortex, so other areas of the brain, but that also impacted the dorsal and ventral streams of vision.
Thank you. So bravo to whoever said that before. Good job.
I have a question. This is Colette.
Hi, Colette.
Hey, could you just restate, go back to the very beginning when you talked about movement and you talked about visual regard, visual attention, and visual interpretation.
Mhm.
Can you just say that briefly again? Because you kept going, that's important in each one of
Absolutely. Absolutely.
Yeah.
Thanks for Colette. So visual regard, we're using our peripheral vision. I know something's there. I can respond to that. I can swat at it. I can smile because I know something's there. Maybe my mom comes really close and I know she's there, but I'm not going to look at her. But we can tell by the change in their behavior that they're reacting, that they understand, that they're regarding whatever it is that's there. Visual regard. It's happening outside of our central vision. Visual attention occurs when we see our student take their eyes and put it right onto the object. So visual regard of my phone would be here. Oh, I know it's there, but I'm not going to look. Visual attention is me bringing my eyes to my phone and looking at the phone. And visual interpretation is when I can look at the message that's on my phone from my best friend and see that she's telling me something that's really good. And so interpretation, regard, attention, gaining meaning is interpretation.
Perfect. Thank you so much.
Welcome.
All right, no other questions?
Do we need to give you our email? I can't remember for the evaluation.
If you'd like to, that'd be great. If you can't access the SurveyMonkey for any reason, and you want to give us your email, we can send it to you that way. But if you have access to the SurveyMonkey,
Is that on here or is that on the? the
Yes, and let
email.
me put it, see if I can send it out, put it in the chat box again, so it's
Oh, okay.
right in the chat box.
Okay. Thank you.
You should be able to click right on it there and fill it out real fast for us. We appreciate it.
Are you going to continue to have different webinars on CVI?
We would love to have whatever types of webinars you would like us to have. So you give us ideas and we will put together a webinar for you.
Okay.
Absolutely.
I'm interested